So liposuction of the back. Where the flanks end and the back begins, or where the back ends and the flanks begin, is not well defined. In general, I like to think of it as the area above your love handles or above your flanks, which is generally about the level of your belly button. If you were to draw a line all the way around your body at the level of the belly button, above that we consider your back. So all that fat under your skin of your upper back or above the belly button level of your back, that would be back liposuction. Liposuction of the area that is your love handles, or I call that your flanks, that is sort of your lower back. Now, when I'm doing liposuction of the love handles or flanks, I can make incisions that are usually hidden by people's underwear or board shorts. When I'm doing liposuction of the back, the cannulas are not that long. And if they were that long, it'd be hard to control them with accuracy. So I have to make little incisions on your back to get the fat out from your upper back, which is all the way up to your shoulder blades and around the sides to either your breasts or your pec muscles. So I need to make usually 2 incisions, one on each side, one right, one left, and they're tiny incisions, 5 millimeters long about, and I'll make them asymmetric. So rather than making them spot on symmetric, which looks surgical and looks odd if you're looking at someone's back and you see tiny little scars at the exact same level. So I'll make them a little off, a little asymmetric, just so it doesn't look so surgical. And that is really back liposuction. So I'll make 2 little incisions, and from those little incisions, I'll suck out the fat of your upper back or back. Using typical liposuction, I'll infuse fluid in, and then I'll break up the fat, and then I will suck out the loose fat cells and the extra fat cells after they're all broken up, and then I will smooth it out at the end, kind of like raking the sand. So we'll get your back tissues as thin as we safely can while making the contour look good. One thing I want to mention regarding back liposuction is lots of people have back rolls, meaning they're those upper skin rolls that are not on your love handles. They're the rolls higher than your love handles. Those would be your back rolls. So I will suck those out with back liposuction. Then we have to rely on the skin to tighten up. The skin doesn't always tighten up as much as we want. If the skin doesn't tighten up as much as we want, you would need an upper body lift or back lift or bra line lift, essentially a surgical procedure to cut out that extra skin at a later date. If I'm offering you back liposuction, that means I am confident that your skin will shrink down or tighten up once the fat is sucked out. And what I need you to do to help that process is to follow the instructions, which are in a separate video. But that is one thing to know about back liposuction, is that it doesn't always treat the extra skin. Most people's back skin, especially their upper back skin, is really thick and it has good elasticity. That's good because that means when the fat underneath it is sucked out, it does a lot of tightening up on its own, which is what we want. Because if the skin doesn't tighten up on its own, then we have to cut it out. And if we cut it out, we have to leave a scar. So that is one part about back liposuction that you need to keep in mind, is if you have rolls up there, rolls of skin, I'm gonna break those up and smooth them out and suck out the fat, because that's what back liposuction is for. But then we have to rely on your skin to tighten up. And if it doesn't, then we would need to go back and cut out that extra skin at a later date. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.